Hello everyone, we are here today to talk to Dr. Akinlolu O. He is the Associate Vice President for Clinical Research and Global Health Initiatives at the University of Arizona, and he is also a professor of medicine. And so today we will be talking about the All of Us research program, and we will be doing that in the context of precision medicine. Dr. Ojo, we're here to talk about the All of Us project, as I mentioned to you. But before we start on that, can you give us a little bit your take on precision medicine and where that is going, what kind of future that brings us?
Precision medicine is an emerging approach to healthcare and prevention of disease that takes into account differences in the lifestyle as well as the environment and the biologic composition, mostly genetic, of individuals. It harnesses all the advances that we have had, including the sequencing of the human genome, the widespread use of comprehensive electronic health record, as well as all the advances in data science with information technology that makes it possible to be able to collect, analyze, and interpret large volumes of data.
So how does the All of Us project fit in with this? Why do we need it? And can you tell us a little bit what it is exactly?
So the All of Us research program is the centerpiece of the Federal Precision Medicine Initiative. The Precision Medicine Initiative was announced in 2015 by the President of the United States, and its goal is to bring precision medicine to the bedside and the care of all Americans, so that the modern advances that I described earlier can be realized at the individual level. Prior to the All of Us program, it is possible to get precision health care, but it is limited in the number of places in which it is available, and it is not accessible to individuals who either they don't have adequate amount of healthcare coverage, or they live in certain parts of the country that do not have access to highly specialized medical center. The All of Us program will bring together 1 million or more volunteers across the entire United States. And these will be individuals who represent the rich diversity of America across all age groups, all race groups, and all geographic areas of the country. And in that effort, the individuals who volunteer to be in the All of Us program will contribute their biologic specimen as well as their health data into a large repository that would then be used to conduct precision medicine research.
So what do you mean by health data? What kind of...
Health data includes electronic health record, as well as information that are collected directly from the participants in the All of Us program. So it will be both electronic health record as well as participant-provided information.
So do they come in? I'm assuming electronic health records, that does not take effort by the participants. But for the other data, is it surveys, or do you do measurements, or what kind of data are you collecting?
Yeah, for the electronic health record, the participants will have to provide consent to have the All of Us program gain access to their electronic health record wherever it may reside. The participant will also have to come in for an initial collection of biological specimen, as well as a limited number of physical measurements. In addition, participants will provide information through the web and will also, and that information will include private health information, as well as information about different aspects of the individual environment in which they live. In addition, we will be collecting data through remotely from participants using different type of sensors. This will be physiologic sensors as well as environmental sensors that can collect heart rate, blood pressure, for example.
Also some in the environment sensors?
We will be incorporating those type of measurements as the project goes on. Okay. We will even be collecting information if the participant chooses to share that information with us in the All of Us program about mood, for example. Some of the things that we will be able to capture remotely using highly sensitive and accurate sensors that are already on the market, including as well as those that are currently in development.
So how do you go about that? So you say you have medical data, electronic health records, then environmental data through sensors, and then some other data through sensors, maybe apps that you use?
Yes,
Is this a phased approach, or do you collect everything all at once from a few people?
It is a phased approach, and we're already collecting some of those data, including data with apps, as you pointed out, and we will be deploying different types of remote data collection tools as the program continues to grow. Okay. And all this data will be integrated together in one location. And importantly, the All of Us program is a transformative approach to research in that the participants themselves will be part of the governing body. They will be partners with the researchers in determining the type of data that are collected, how the data is used, how information is returned to the participants in the program. So the individuals who sign up for the All of Us program are partners in research and not research subjects.
So how do you organize that practically?
It is a large effort. The All of Us program is the largest biomedical research program ever embarked upon anywhere in the world. It is headquartered at the NIH. There is a large team of experts leading the program out of the National Institute of Health in Bethesda. In addition to that, there are more than 100 components. These are entities including academic medical centers like ours, as well as community organizations, and a biobank for the storage of biological specimens that are part of the All of Us program.
So I can imagine there are many researchers who have questions that could be addressed with this kind of data.
Yes.
You say that the participants are not subjects but participants.
Yes.
So do you educate them? How do they know what kind of data they would like to see collected and stored or used? You mentioned they have a say in that, so how do you manage that aspect?
So every entity that is bringing in participants into the All of Us program, like we are doing here at the University of Arizona Urbana Health, has a participant engagement board. And the participant engagement board is a committee of participants, and they sit down with us to determine the structure of the research plan that we are going to be conducting, the type of data that we are collecting, as well as providing input into all aspects of the activities of the program. In addition to our own participant engagement board, there is a national participant engagement board that sits alongside the steering committee, and the steering committee, which provides the overarching governance for the project, also include members of the participant engagement board and representative of participants who participate in all aspects of decision making that governs the program. You ask the question, how do those people know what question to ask, or how do they play their role alongside researchers? One is that they are provided with information to be able to make decisions, and they have access to experts that they can ask the opinion of experts, and many of them are informed, and the idea is that the data that we collect in the All of Us program will be used by all types of researchers, including researchers that are funded by the public sector, as well as the biotechnology pharmaceutical industry, as well as citizen scientists. So scientists or citizens can get together, determine an important question for their own health that touches on precision medicine, and bring that forward and use the data, the biological specimen that we collect in the All of Us program to address those research questions. An important aspect of the All of Us program is also the fact that the participants who sign up to participate in the All of Us program are also giving us permission to recontact them, to bring them in for additional measurements, additional specimen collection, and to participate in specific research projects.
So how does the recruitment work? And I'm asking this because of their involvement of the participants, right? I would imagine that people who have, for example, a rare disease would be much more interested in participating because they might think, rightly so or not so, I don't know, that they can influence the research questions that are being asked. So do you have a mechanism to make sure that you have representative participation, or is that not a big issue at this point?
We're not striving for representative participation. What we are striving for is that those million or more individuals are reflective of the diversity of the country. So they include all ages, all racial ethnic groups, and importantly, at least half of those individuals will be individuals that have been typically underrepresented in biomedical research, and that includes several groups. So we have, in the All of Us program, we have about 11 categories of people who have been typically underrepresented in biomedical research, and we are intentional in making sure that those individuals account for at least half of the individuals that join the All of Us program. And the calculations that have been done by experts indicate that when you assemble 1 million or more people in the fashion that I have just described, that you will be able to address important precision medicine research questions. And it is our long-term plan in the All of Us program to become a federated research entities in which we are establishing collaboration, exchange of information, and conducting research together with entities that are patient advocacy group, entities that currently represent individuals with rare disease conditions, for example, polycystic kidney disease, cystic fibrosis. So we will be working with organizations that currently have a more concentrated collection of individuals with rare diseases, because even with 1 million people, it is not possible to capture adequate number of people for research for conditions that are extremely rare.
So you mentioned 11 categories as a side note here.
Yes.
Usually when we submit grant proposals, for example, to NIH,
yes.
there are fewer categories that are mentioned that
yes.
you have to make sure that are included. So 11 categories of people who are usually not included in biomedical research. Can you give a few examples of these categories? Thank
you very much. That is an important and innovative aspect of the All of Us program. Those categories, those 11 categories include the traditional categories of underrepresented people based on race, ethnicity, Hispanic, non-Hispanic, African Americans, Native American, and as well as Alaska Natives. In addition to those categories, we have categories of extremes of age, very young and very old. We have categories based on place of residence, rural versus urban. We have categories based on abilities in terms of physical abilities. We have categories based on sex orientation and gender identity, and we have categories based on socioeconomic status.
That's very different indeed. So you started collecting data about a year ago in 2017?
Nationally, data collection started in May 2017. Here at University of Arizona Banner Health, we started collecting data January 2017, and we will continue to collect participants into the program for the next 5 years.
So how far are we? How many people, do you have an idea nationally, and in Arizona, how many participants there are?
Nationally, as of this morning, we have more than 75,000 individuals who have signed up to be core participants, individuals who are providing access to electronic health record, consent for genetic studies, as well as providing biological specimen to the program. Of those 75,000 individuals, approximately 17,000 individuals are from Arizona. So we are doing very well. At the present time, we in Arizona account for about 23% of everybody that have joined the All of Us program. And we are very pleased and proud of that.
That's going according to plan then?
That is going better than planned.
Oh.
Because we have the support of the institution of the University of Arizona leadership at the level of the president and the senior vice president for health sciences. We also have the support of Banner Health leadership in terms of providing additional resources on top of what the NIH has provided to make sure that we are successful here in Arizona. And as you may well know, to get Arizona represented in the All of Us program, we also receive support from the governor of the state, Governor Ducey, as well as from many of our representatives in the United States Congress and state legislators.
So, to conclude, my last question for you is, before we conclude this interview, are there any groups that are not as well represented that you would like to point out and maybe call for more representation or people to volunteer? And do you ask people to volunteer? Can they just sign up, or how does that work?
We ask people to volunteer. We have locations throughout the state in hospitals, and we also go out into the communities in mobile vans. And we have experts who are responsible for helping us to engage people in the communities. We are also working with several community-based organizations that help us to disseminate information about the All of Us program. And what it takes on the part of individuals who want to participate is to listen to us, learn more about the program. They ask us questions, we answer those questions, and they have the opportunity to sign the consent document after understanding it, and then we make arrangements either on site or bring them into one of our facilities to do the physical measurement, collect biological specimen, and there is a large digital component to the All of Us program, so we can send information back and forth to participants with their mobile phone, and they can get the information from us, and we also receive information from them on their digital devices. And in terms of individuals that we want to come forward, it's everybody. We would like to see more people, all people, to step forward and be part of the All of Us program, because it is the cutting edge of healthcare. Importantly, the information that we collect in the All of Us program And the test and the research that we do, we return the results to the individuals, and we anticipate that these results that we are returning to the participants will be helpful in their own healthcare and health behavior.
That is great. So I hope after this, maybe you'll get a lot more participants from people viewing this video. Dr. Ojo, thank you very much for doing this interview with us.
Thank you very much for giving me the opportunity to represent the All of Us program from University of Arizona Banner Health.